download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's daily bulletin. Controversy has erupted over a recent order issued by a UP-based private medical college that has imposed ₹500 fine on its students for missing morning lectures. Sharing the copy of the order on Twitter, Dr. Meet Goenia of Gujarat asked if NMC permits such a form of penalty for missing classes. The concern letter has been issued by the Bharwar-Beaded Heritage Institute of Medical Sciences. Taking note of the absence of students from the morning classes, the principal cum CMS of the medical college issued the order on 14th of November and stated that it has been observed that many students are missing morning classes which start at 8:30 am. Institute administration has taken a serious view of this. Today morning in a class of 2019 batch, very few students were present. This trend is seen mostly in 2019 and 2020 batch. They are in habit of missing morning classes. In order to deal with this problem, the college has decided to charge the absent students with ₹500 for missing the morning classes. Through a recent notice, the University Grants Commission has announced its decision of increasing the stipend of intern doctors in medical and dental colleges and hospitals of central universities from $23,500 to $26,300 per month. This decision was taken by UGC in accordance with an order of the Union Ministry of Health and Family Welfare, which has increased the stipend of MBBS interns of central government institutions and hospitals last year. An international team of researchers has found a significant decline in sperm counts over the years in many countries globally, including India. Sperm count is not only an indicator of human fertility but also that of men's health, with low levels being associated with increased risk of chronic disease, testicular cancer and a decreased lifespan, the researchers said. The decline reflects a global crisis related to modern environment and lifestyle with broad implications for the survival of the human species. The study, published in the journal Human Reproduction Update, used data from 53 countries. It includes an additional 7 years of data collection and focuses on sperm counts trends among men in regions not reviewed previously, specifically South America, Asia, and Africa. The data shows for the first time that men in those regions share the significant decline in total sperm counts and sperm concentration seen previously in North America, Europe, and Australia.
Currently, we all know that many vaccines against SARS-CoV-2 have substantially been found to reduce their mortality and also the severe progression of the disease, but protection against the infection is less effective. Vaccinated individuals are still catching COVID-19 and can eventually even spread the infection. So breakthrough infections are still occurring. Researchers from the Centenary Institute and the University of Sydney have developed a new nasal vaccination strategy that induces potent lung immunity and protection against the SARS-CoV-2 coronavirus. The flu has been long associated with an increased risk of life-threatening cardiovascular events, and even people with heart failure are already highly vulnerable to poor health outcomes. So an international study led by the McMaster University researchers and published in the Lancet Global Health has found that influenza vaccines greatly reduce both pneumonia as well as cardiovascular complications, specifically in people with heart failure. The study is the first clinical trial of the flu vaccine's effectiveness in patients with heart failure, and it also showed that over the entire year, the influenza vaccine reduced pneumonia by 40% and hospitalization reduced by 15% in patients with heart failure. During influenza season in the fall and the winter, specifically, the influenza vaccine reduced the deaths by 20% in these patients. The term relative humidity is the amount of moisture in the air as compared to the total moisture in the air that can actually hold at a given temperature before saturating and even forming condensation. So in a study appearing in the Journal of the Royal Society Interface, it reports that maintaining an indoor relative humidity between 40 and 60% is associated with a relatively lower rates of COVID-19 infection and deaths, while indoor conditions outside this range are associated with worse COVID-19 outcomes. So to put this into perspective, most people are comfortable between the 30 and 50% relative humidity range, and an airplane cabin is at around 20% relative humidity. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.